Pearson will soon be launching a revolutionary program called NovEx that addresses these issues. NovEx will be available for testing by BSN and ADN programs in the fall of 2013 and spring of 2014. The rest of this short video will tell you and show you more. Patricia Benner is one of the experts behind the program, continuing work begun over 30 years ago on the development of expertise from the novice student to the expert practicing clinician. At that time, Pearson published her groundbreaking work, From Novice to Expert, which outlined principles that have continued to be the cornerstone of transformative efforts in nursing education and practice. In recent years, Dr. Benner has been an important influencer and supporter of the urgent recommendations made by organizations to change the face of nursing education. One of the many calls to action has been to better prepare students for practice and for learning in the classroom to be directly integrated with what happens in patient care rather than in the abstract. It was in the midst of this swell of research and recommendations for change that Dr. Benner teamed with two colleagues, Dr. Pat Hooper-Kyriakidis and Dr. Tom Ahrens, to begin developing and testing NovEx, their interactive, evidence-based digital learning solution. Their goal was to help facilitate the changes needed to make these recommendations possible at the classroom learning level, including providing the tools that allow student integration of knowledge acquisition and use. Also, earlier development of clinical reasoning and good habits of practice, and just as importantly, to support educators in their ability to make the needed changes. The desired outcome, graduates who perform more skillfully in real-world clinical settings, or simply said, practice-ready nurses. And now let's take a look. NovEx offers e-courses that correspond to the courses offered in a typical BSN program: adult health, health assessment, maternal newborn, and so on. NovEx courses are also appropriate for ADN level programs. In every course area, NovEx provides students with the clinically relevant knowledge they need and case-based simulations in which to practice clinical reasoning and judgment in a safe environment. It also empowers educators to use their clinical experience and knowledge to teach and coach novice learners to become practice-ready professionals. And it provides a proven format that allows teaching and learning to happen easily. Each NovEx course is divided into topical chapters and then modules. Each module includes content and work for home and class. First, e-lessons with assessments and NCLEX questions. Second, unfolding interactive case simulations. And third, faculty aids that support an educator's use of the cases in the classroom, and assistance in integrating the instructor's vast clinical experience into class case discussions. Let's look at a snippet of the NovEx lesson on pneumonia, taken from the oxygenation chapter found in the Adult Health 1 course. Rich with multimedia, illustrations, animations, videos, and instructional art, NovEx e-lessons focus student learning on the salient and relevant clinical and scientific knowledge needed to perform successfully in the NovEx case and practice environments. Animations help students learn by visually depicting complex concepts. Assessments in each NovEx e-lesson allow students to check their understanding. In addition, NCLEX-type practice opportunities are added so that students can progress toward mastering licensing questions. Unlike traditional learning, students immediately use the knowledge learned from the NovEx e-lessons by solving problems presented in the practice cases, which are based on real patient responses and also done at home. There are a multitude of unfolding, unprompted cases available. Students are challenged to assess the patient's clinical condition using all available information, attend to patient trends, respond to clinical changes, identify problems, and solve them. They learn the habit of evaluating patients after each intervention. They see the results of their interventions, gain a sense of time-related responses, are given feedback, and can make adjustments. This interactive process engages students to grasp the nature of clinical situations, develop clinical reasoning, learn predictable clinical trajectories and response patterns, and prioritize interventions, all habits of practice that are essential for developing expertise. And now let's look at the Butler case. When a student enters the virtual patient room, a brief report is provided. We see here that Ms. Butler has recently had bypass surgery and among other things is short of breath, coughing up green secretions, and is worried about her husband who is having chest pain in another hospital. The physician is concerned about MRSA. After the report, learners can freely navigate the room. There are hotspots that simulate equipment found in a real patient's room, which they can click on to get pertinent information. Icons at the bottom provide another means for obtaining patient information that was available in Ms. Butler's chart or room. We click on the Speak with Patient icon as part of our assessment, and we see she's having trouble breathing. When we click on the Examine Patient icon, we see that she has crackles in both lower lobes as the only remarkable finding. The student can click on the Monitor hotspot or icon to view the vital signs and see tachycardia, fever, tachypnea, and a low pulse ox reading. Additionally, students can assess the patient's medical record, family, diagnostics, and more to gain a full understanding of other abnormal findings for this patient. Because students learn the importance of oxygenation, they can click on the oxygen hotspot where they are given the option to increase or decrease. Brief feedback is provided, a cue to continue. Unless the student initiates evaluation of the patient's response to oxygen, nothing happens, as the case is unprompted, just like in real life. The student can speak to the patient again, and she says here she feels a little better. As importantly, students learn to click on the Monitor hotspot after administering oxygen to see the patient's pulse ox reading. Notice the oxygen helped the patient. The student can then examine the patient to notice that oxygen has no influence on the crackles in both lower lobes or the pneumonia. Once students fully assess the patient again, the responses should cue thinking and reasoning to start dealing with the cough and green secretions. Students know they have standing orders and can give the needed antibiotic. The student drags the IV antibiotic into the cart to the right. The student then drags the antibiotic to the patient and receives feedback. Notice the time that has passed to give students a frame of reference about when to expect a patient's response from the antibiotic intervention. The student can talk to the patient, and here we see she feels a lot better. The student can examine the patient and observe vital signs again. Notice now, after 24 hours, that all the vital signs have returned to normal. With no further care required at the moment, the student can click on Finish Case, and here they receive feedback. The student's choices are listed on the left, while the correct interventions are listed on the right. If students fail the practice case, they can simply restart the case after reviewing the corresponding e-lesson and try again. And now, what happens in class? NovEx employs an approach where educators are encouraged, prepared, and supported to spend less time lecturing in class and more time delving into real cases, use small and large group discussion and sharing, and provide their actual clinical experiences and perspectives to coach students on how to skillfully perform in various situations. Communication, ethical issues, family members, leadership, teamwork, conflict, end of life, and other everyday issues are woven into the cases during class so that important nurse-patient and nurse-team role-playing can take place. Let's go back to Ms. Butler and see an example. Imagine that students are coming to class having completed the pneumonia e-lesson and the multiple cases that you assigned to them, including what we just saw with Ms. Butler. In class, the educator uses the same cases with added elements, and if desired, their own clinical experience to engage students in discussion about real-life issues that students will inevitably face. So what you're seeing here is Ms. Butler again. This would be shown in class. This time, when the report is shown, another aspect is brought into the case in a pop-up box. After report, the nurse asks you to help her suction Ms. Butler before she leaves her shift. While suctioning, you noticed her contaminate the catheter but continue to use it. What do you do and how? This is a great real-life issue. The educator then challenges students to engage in first person and discuss the possible answers. and the educator uses their vast clinical experience to guide and coach students to the best answers. Several schools have already tested NovEx in their classrooms with much success. Listen now to two students commenting on their experiences.
It was a lot more interactive. It wasn't just you reading, taking notes, highlighting, all the key stuff was there for you, and then taking it into an actual, like a simulated setting and doing it, just like it's real life. Just how we, in class, we want to say, if I was talking to the patient, you guys try to get us to step out of our comfortability zone and say, okay, act like I'm the patient. What are you actually going to do when you're in there?
Because we're on a lot of us are in cardiac or med-surg floors, so we've already touched on some of the aspects that we're approached with. So if they have COPD or they have asthma, we notice the medications, plus we understand the treatment and what actually happens with their types of situations. So if they have any questions, we're not afraid to talk about what we've learned. So we took that knowledge and brought it into our own clinical setting.
We hope you are as excited about NovEx as we at Pearson are. Please contact us for more information for test, pilot, and review opportunities and the NovEx course release schedule.